Welcome to today's webinar, Back to School, Support, Advocacy, and Empowerment After Treatment for a Pediatric Brain Tumor with Dr. Sharon Guger. My name is Tanya Janalia, and I'm the Research and Education Specialist with Brain Tumor Foundation of Canada, and I'll be moderating today's session. Dr. Sharon Guger is a pediatric neuropsychologist working at the Oncology Aftercare Program at the Hospital for Sick Children. She completed her clinical training at Sick Kids and has been working with survivors of pediatric brain tumors for over a decade. The Sick Kids Aftercare Program provides follow-up care to meet the unique healthcare needs of childhood cancer survivors. The goal is to protect health and promote quality of life through ongoing monitoring and treatment for potential medical, learning, and emotional or social problems. Dr. Guger's research interests include neurocognitive and socio-emotional late effects of pediatric brain tumors and the promotion of transition from pediatric to adult healthcare settings. In today's webinar, Dr. Guger will talk about returning to school after treatment. Returning to school can be a welcome escape for medical procedures, signaling a return to a normal routine. Some survivors of pediatric brain tumors embrace this return, while others may dread it, potentially experiencing frustration with learning and/or peers. This webinar will provide some guidelines and recommendations for parents, educators, and survivors on the journey back to the classroom. Information about how to communicate with your child's educators and support your child both academically and socially will be reviewed. Ways to effectively advocate and develop a collaborative relationship with educators will also be discussed. Finally, we will explore the value of engaging and empowering survivors as they consider post-secondary academic and/or vocational paths. So Sharon, I'll hand it over to you.
Great, thank you, Tanya, and thank you everyone for giving up some of your time on a Saturday to join us. And hopefully today's presentation will address some of your questions that you might have as you're planning, looking ahead at the future with your child or teenager and to the next steps in the journey after treatment for a pediatric brain tumor. So as was already reviewed, some of the objectives of our talk during this webinar are really to get a better understanding of some of those academic and social issues, but also some of the tools and knowing some of the ways that you can communicate with educators, because really when you think about it, going back to school is like going back to a job for kids, and their bosses are their teachers. So while teachers may be very well educated in how to provide excellent learning opportunities for your children, they may not be as well educated on the journey that your child has had after being diagnosed for a pediatric brain tumor. So sometimes that's often the role that parents and hopefully your healthcare team can help teachers with. And as well, that responsibility of educating the educators has to be something that a pediatric brain tumor survivor takes on themselves. And that's where the empowerment and self-advocacy comes on, planning for the future as an adult. So hopefully we'll be able to address some of those issues and some of those questions as we move forward to the seminar. So treatment is potentially over or ongoing, but it's time to go back to school. And for brain tumor survivors, school can be a place where certainly, like all children, we hope that they fulfill their potential. But also, life is moving forward. It's a step that it's not just about the hospital anymore. It's about connecting with their peers, connecting with their teachers, reconnecting, and it can be something very exciting and going back kind of to the new normal, but it can also be a little bit daunting as well. And despite all of those kind of optimistic feelings, those aspects of the treatment that can be so effective in helping your child can also have an impact potentially on a child's learning abilities. It could be about fatigue, stamina. It could be how to interact with their peers, how to talk about what they've experienced or whether or not they even want to talk about what they've experienced. And there could be some real physical issues as well that might be affecting behavior within the classroom or even just mobility around the school itself. And those effects aren't necessarily just occurring right after treatment, but there are some effects that we will talk about a little bit that can be ongoing or actually demonstrate themselves, show themselves after treatment and potentially years later. So what are some of those effects? So certainly at diagnosis, there's some obvious, very obvious effects of the treatment, the tumor and the treatment. But then you've got the radiation or the surgery, any potential complications which can have very real physical impact and potentially behavioral impact as well. But some of the things that I want to talk about are things that can be happening as early as 6 to 12 months after treatment, especially when we're looking at some of the more physical things, the impact on balance, what that means out in the school ground, what that means potentially on coordination, vision, hearing. We know that some drugs can have an impact on high-frequency hearing. So that, in fact, actually can have an effect on what does the child hear within the classroom environment. If they're learning to read, it can impact their ability from the phonological processing, which we know is a key part of how you learn how to read. You're hearing those sounds together, and then you're trying to translate those into the letter sounds. As well, there are some psychological impacts that can take place, both immediately and in the long term. Some of it, some kids can feel withdrawn. They may feel or look different from their peers. I know certainly most pediatric oncology or brain tumor teams have social workers and or child life or nurses that go out into the community at diagnosis and during treatment to talk with classmates, to talk with schools about what a child is going through in a developmentally appropriate way. And that can be really, really important for helping the classmates and other children in the school understand what a child might be experiencing and making it not as scary or less scary from what might be taking place. As well, there's opportunities now, particularly with some of the technology that's out there, for kids to Skype from their hospital beds. And that way there can be an ongoing contact even when they're in hospital. Some kids have actually experienced a lot of success in taping, having their parents tape something on their iPhone and bringing that in and having that projected in the classroom, or actually being able to tell their own story. Different children with different personalities all have different ways of adapting to that experience. So it's really important to, as much as possible, take advantage of your healthcare team in the most positive way, and that they're here to help with that connection with the community. And I certainly encourage you, and I think all healthcare providers would encourage you to remain as connected as possible with the school, even while your child is on treatment. They may be able to send some information or some reading along so that this child still feels some degree of connection. But beyond that, even 6 to 12 months later, there can be what we call late effects. And those late effects are what we consider to be kind of complications or outcomes that are a result of the disease or the treatment. And they can last quite a while. It can happen at the age, it depends on how young a child is when they're diagnosed, how and what type of radiation and or surgery they may be exposed to, and what those, and if they experience any complications. So it's a bit of a Rubik's Cube at times, but certainly late effects are things that your healthcare team will know about and will talk about, and how they may change potentially over time. They can affect many different things. I've already spoken about some of the psychological. Certainly the physical, we know some of the chemotherapeutic drugs can affect aspects of the development of some of your cardiac function, as well as pulmonary function. But we also know that radiation, in fact, has some significant impact on growth. Again, it depends on the type, the nature of focal radiation versus full cranial spinal radiation. We know that certainly all of those things, when you take a step back, can have an effect on learning. And that's really what I'm hoping today that you'll get a little bit more and learn a little bit more about, is how does this whole treatment experience affect a child's learning, and then what can you do to help and empower your child moving forward. So I've already briefly mentioned some of what might be the psychosocial, so the psychological or the social concerns. You know, for families, after going through a treatment experience, there's a shift in the dynamic. And then trying to return back to school, there can sometimes be increased dependency of the child on the family, or independency. They want nothing to do. They just want to get back to their normal. And so there might be some issues around parenting, discipline, and kind of regaining a new kind of family dynamic. And keeping in mind, of course, also where siblings fit into this, because they've also gone through the treatment as part of the family unit. For children, if they've been isolated for obvious reasons as part of their treatment experience, if they've had to be away, they might have been geographically far away from their peers. Again, that's where hopefully something like Skype or other kinds of FaceTime, which is a Macintosh tool, that can really help to minimize some of the social isolation. But the self-esteem can certainly be affected, and how they feel about themselves, how they feel about their mortality, their understanding of their mortality. These can be real concerns as that people move, as children move forward. Also, their own body image. If, depending on their treatment, loss of hair, potentially altered function, there may be obvious scars, that can be a real concern for children going back. And certainly there are ways for teachers, schools, and healthcare teams to work together with parents and children to address that and be sensitive to that moving forward. And realistically, going through diagnosis and treatment for a pediatric brain tumor can certainly raise, it's one thing to come through the first of the fire, but you're hoping desperately they don't go through that fire again. So certainly, and there's understandably fears of recurrence and potentially secondary malignancy down the line. But that all has to be integrated into that. The reality is that they are through this experience, and how do you integrate and realistically deal with those fears. And most healthcare teams will have social work or a health psychologist to help families work through some of these fears and most importantly the child and teen. And then moving down later on, far beyond the treatment experience, who do you tell about your treatment? I know a lot of teens that I've worked with, when they go off to university, the last thing they want is for anyone to know about their health care or their health experience. They don't want to know anybody that they had a brain tumor. They've got their hair back, they're walking, they're talking, they're doing well, they're exploring their world just like their friends are. But the reality is there may be some good reasons to disclose, but part of that growth and learning as you move into that next transition is who and when do you expose or disclose information about your medical experience and your medical history. How and when do you expose it to a love interest? How and when do you expose it to employers? How and when do you provide that information to other educators? Those are some things certainly to think about, and hopefully we'll address a few of, certainly some of the work issues moving forward. So let's get to the cognitive stuff. Let's get to the learning stuff. It's easy for me to say, oh, there might be a problem in this particular area. But what is it that teachers and children and parents, most importantly parents and teachers, are observing? They might see that their child's or their student is having a hard time focusing. They kind of tune out. Or they seem to understand something one day, but then they can't seem to demonstrate that knowledge another time. Or they just can't seem to keep up. They're not able to copy things down from the smart board or the blackboard, and everybody else seems to be rushing ahead. They might be having a hard time getting stuff to and from school. Now, granted, many students have that problem, getting things to and from school, but it would be a noticeable difference, or they're missing assignments. They're not handing things in. They're not bringing home notes from the school teacher, things to get signed. It might be that they're taking a very, very long time. They need multiple breaks. They're unable to get their homework done. And, of course, all of these things may result in grades that are going down. And not surprising, there might be some frustration with assignments. Now, for many brain tumor survivors, they may actually have an assessment while they're on treatment in the hospital, or what we call a baseline. They may have then, and if not, then there are different reasons for that, but there may be a cause for an assessment later on. So what is an assessment? And when I talk about a neuropsychological assessment, what that is really is an assessment of a child's strengths and weaknesses. We all know what's difficult. Everyone is able to identify quite readily what they find more challenging. But what we often don't do is really reflect on what we're good at or where our strengths are and how we can use some of those strengths to support our weaknesses. So really the goal is really to understand an individual child's cognitive, so thinking, as well as some of their behavioral functioning. And with that assessment and that information, to use that to support school performance on and beyond treatment. And there's a little bit of fortune telling that happens as well, kind of looking in the crystal ball, because what we do know is that we can anticipate what some of those future challenges might be, both in the learning as well as in the social domains. So once we've done an assessment, and I'll talk briefly about what an assessment might look like or some of the areas that it might cover, but once we've done an assessment and there's a report that comes with it, we can't necessarily fix what those challenges are, but what we really try and do, as I said before, is use those strengths that every child has to really support their learning and perhaps alter the academic demands or in the way in which a child is taught or assessed, evaluated. when I say evaluated, I mean tested at school. Really, it's about making the fit between the child and their world a better match. That's really kind of the definition of stress, is when there's a mismatch. So what we want to do is, as much as possible, kind of put those puzzle pieces closer together. So what's evaluated in a neuropsychological assessment? Well, we look at all of these areas, and so that's why they're so long. The assessments will sometimes take 2 half days. They may take as long as a full day. And depending on where a child is and how old the child is, certainly assessments take a lot longer the older a child is, because there's more areas to evaluate. Younger children, certainly those that are just entering formal school, we do a lot less. It's more of a screening, but still it's information that's really valuable for daycare providers, nursery, kindergarten, and as well as hopefully it's being able to put some evidence on the table and provide something that we can compare with future functioning. But as a child hits school age, we can really look at all of these different areas that you see up on the screen. One of the core areas that we start off with often is intelligence, or really thinking abilities. We look at that, language, we evaluate visual skills, as I said, verbal skills. How are they able to learn and remember new information that's presented in different ways? How efficient are they in terms of their ability to process information, both mentally as well as kind of a hand-eye coordination? Attention, how well can they focus? How well can they filter distractions? And as they get older, how well are they able to organize themselves? How well can they initiate things on their own? It's that learning to learn that becomes particularly important in the middle school and in the secondary school years. And we pull all of that together, and you need to filter that again through emotion and behavior. Many of us know what it's like when we're stressed, if we're very anxious about something, trying to get somewhere and the traffic is really busy and you're stuck in a traffic jam. It affects our ability to focus and pay attention. Similarly, we do know that research shows that individuals who are depressed often have slower processing speed, but particularly it can affect your memory. So the filter, the lens through which a child is experiencing their learning in terms of their emotion and behavior can be very valuable as well. So as you can see from all of the things on the screen, there's a reason our assessments take a while. It's a little bit more than a blood test. And that's sometimes why we often will do it over multiple sessions or 2 half sessions, because I know for me as well as my colleagues, really we're not just looking to test the child, we're looking to see the best that they can do. So we can really use that information to inform and empower the child and their parents and help the teacher know how to best educate the child moving forward. So in that previous slide, there were all those different domains: memory, attention, motor function, all of these different things. Well, what I'd like to kind of highlight here is what are those deficits or challenges that a child who's had a pediatric brain tumor may experience. It might be a little bit of everything. It might be just solely in one area, depending on the type of tumor and associated treatment. But some of the things that we do see, and in the black you'll notice it says kind of one area of challenge, but this is what it would look like, would be the bullet points underneath. So if a child is, we've noticed that they really are having a high difficulty with focus and being able to sustain their attention. These would be the kids who are having a hard time following instructions. They have a hard time kind of pulling it together in a really busy classroom, or when studying at home, they can't tune out the TV or the phone. Information processing, it's a fancy word for basically how well can you cope with and efficiently move through things. So starting and finishing an assignment, how well can they handle lots of input? How efficient are they at kind of hand-eye coordination? Difficulties with memory, slow rate of new learning. They might have a hard time in classes where they're required to learn facts. They might have a hard time really being able to kind of regurgitate things, maybe in a spelling test. They have a hard time with rote learning. And traditional teaching and assessment of knowledge in the classroom often relies on some degree of rote learning and memorization. And this can be something that can be really difficult for many children. Working memory is a term that we use in neuropsychology, and it's that kind of that interlink between attention and memory. It's remembering something long enough to act on it. It's remembering a phone number long enough to write it down. It's being able to listen to me and read what's on your screen at the same time, but you don't have to memorize it. It's, when you think about it, it's what a child has to do every single day. We all have to do it, but in a classroom setting, when teacher says, everyone please take out your math books, I'd like you to go to chapter 5, and we're going to continue on the left page doing every other question. A child with poor working memory may take out their math book, and then they might be the child who's looking around. What's the next step? It might be the child who you send upstairs, okay, go upstairs, brush your teeth, but on the way back down, can you make sure you pick up your socks at the top of the stairs? They're not going to remember those socks, or they might just get the socks. It's how many steps can you follow? And not surprising, if that's an area of challenge, focusing on more than one thing at a time or multitasking can be difficult. Lastly, this automatic processing. As you get older, as you learn more, the expectation is that you have a foundation of facts and skills. So for example, reading. Initially when you're learning to read, it's a lot about sounding out, understanding the phonological connection between the sounds and the letters. Then it becomes about recognizing the words, and then there can be much more common words that you read automatically. For children who have difficulty with automatic processing, everything takes effort. They can't work on automatic pilot, and everything requires a great deal of focus, which can be very tiring. So when all this is going on, or some of these things are happening, and we've kind of validated that through neuropsychological assessment, what now? Well, I know I'm kind of based out of Ontario, but I understand we have quite a few people from across the country, and different school boards and ministries call them different things. But at the end of the day, an individual education plan is a customized learning plan for a child, and often a child with learning needs as a result of a pediatric brain tumor or for other reasons would benefit very much from the development and implementation of an IEP, or an individual education plan. Now, an IEP really, I really emphasize to many of the families I work with, is it's not just a pile of paper that comes home for you to sign and send back. Ideally, it is an organic document that reflects where your child has been, is, and will be going in terms of their learning. It really should reflect abilities and challenges, areas of need and opportunity, and that would be based on schoolroom observation, teacher input, because that's where the child's spending most of their time, as well as information from neuropsychological assessment and any other kind of specialists who may be involved in their care, vision, hearing, and so forth. What kinds of supports and services or accommodations would a child benefit from? And those really should be following from the neuropsychological assessment, as well as things that happen in the classroom. How will the child participate? How are they going to take part in the curriculum and any extracurricular activities? Are there provincial standardized assessments? If so, how will the child participate? Will there be supports put in place? What access to supports will they have? This is really your template. This is the paper reflection of your child and the opportunities and supports that they may have. And with all these things in place, how will that student's progress be measured, moving? And that's where I talk about it being an organic document. Really, it's the opportunity for it to document not only where the needs are, but what's being done and how is it being measured. And beyond, what's the plan for the future? I think it's really important for families to appreciate that, I mean, you already know that you're the best possible advocate your child can have. Within the hospital, within the community, and also at school. But as your child's advocate in the classroom or in the school environment, you really are an equal partner in the development of the IEP. You should know that you can call for a meeting. I know certainly within Ontario, if you request a meeting with respect to placement or any kind of learning needs, if you put that in writing in a letter form, the school is required to act on it. It is legally required to act on it. I think it's really important, especially in that earlier transition back to school, or if there's any difficulties in kind of making some moves forward, that parents, they can bring an advocate. I often encourage parents as early as possible to include the child themselves. You know, they're the one who knows what's working, what's not working, or they can reflect on what the experience is like. So I encourage them to bring them, and it really, of course, depends on the age and kind of the insight of the child or the adolescent, but I think it's particularly in adolescence really important, kind of in that, you know, the pre-adolescent kind of tween time, for them to be part of those meetings as well. Now, I am aware that I want to make sure that we stay on time, and some of these slides are a bit wordy, but here's some of the things that might be on an IEP and some of the strategies that could be helpful given some of those challenges I talked about before. You want to make sure that there's a sense that there's a lesson outline or a study guide potentially that a child might have access to, and teachers potentially can highlight valuable terms, important terms and concepts, perhaps shorten assignments if stamina is an issue, or if your child has slower written output or slower to write things down. If they can demonstrate that they know something in 15 questions, then perhaps they don't need to do 20 or 25. Extra time, certainly for a lot of children that I've worked with who have been treated for a pediatric brain tumor, that extra time is really valuable. Now, it's a bit of a double-edged sword, because I want extra time to complete tasks or exams, but you don't want so much time that if they still don't have access to the content, then it becomes very stressful in that they have all this extra time and they can't do it. So I think that extra time is a very valuable accommodation, but I think it has to be used wisely and discussed on an ongoing basis. Tutoring is always a good idea. I think we could all benefit from tutoring in some way or another, but I think that there's certainly opportunities to take advantage of in-school resources, potentially if there are certainly resources within the community, but I think as well peer tutoring is something that can be very helpful. Certainly many jurisdictions have an expectation that high school students get community hours, and that could be if resources are a challenge for a family, they may want to ask a high school math teacher or special education teacher if they know of any high school students that are strong students that could potentially offer some tutoring to a child who's more school age. I think it's important to take consideration of potentially having lessons recorded or having teachers provide copies of their classroom notes to students or their lesson outline, so that the students can really be paying attention to the lesson and not struggling to get all the information down. In the same way, the scribing can also be helpful or a note taker. Certainly, the use of a calculator or math facts table can be very, very valuable to a lot of students. You certainly want them to understand the procedures of math and some fundamentals, but there's a point where long division is not necessarily going to be something particularly useful down the line. So certainly the use of a calculator or math facts such as multiplication tables are often used as accommodations. The idea of multisensory methods of instruction is really, especially for the younger ages, is using as many different senses: seeing, hearing, doing, repeating, saying. We know physiologically that increases the connections between different parts of the brain, but also it helps in terms of rehearsal method for children to learn. Hands-on tools, and when possible, perhaps have alternate means of assessing knowledge, so different ways of getting tested, and I'll talk a little bit about that in a second. Assistive technology is a whole other world. I'm going to touch on it a little bit. I think it's one of some of the smartphones, tablets that are out there are some of the most exciting things possible for some of the children that we work with, and I think really it's a matter of making the connection with IT people within the school board, and depending on your jurisdiction, different ministries of education have different regulations, but getting on that as soon as possible if it is deemed by through an assessment as being helpful, I think is huge. Some of the environmental strategies can be about just structuring the environment, what we call preferential seating, which is really sitting at the front of the class. Having a child who's having a hard time with distractions and work in a quiet spot, but at the same time you don't want them so far removed that then they can't be getting any support or any help. One of the things I really encourage families to do is work with their educators to come up with a kind of system that the child and the teacher has to help redirect them without singling them out in the class. There's nothing worse, I think, for a child than being told to focus or kind of being called out in front of the classmates, because that just makes them a target, and that's already happened enough. So some classroom teachers, for example, will come up with a signal just in between the child and the teacher, and it could be when I come by and I put my hand on your shoulder, I need you to kind of tune in, okay, buddy? Or they may have a card on their desk that when they flip it over to the red side, the teacher knows that they need some help. It could be things just as subtle as that, but enough that it helps reduce those distractions or engages teacher support. Thinking about environments that can be overstimulating and overwhelming for children be really important as well. Cafeterias, hallways, planning for when there might be an onslaught of sensory stimulation, and also having to navigate some of those things can be really important, and those things can also be in the IEP. All of these things I'm talking about can be in that individual learning plan. What are some of the things that there might be problem behaviors? There might be some difficulty with behavioral control, anger management, or increased emotional reaction. So really, what's really key is having that ongoing communication, either by email or with the agenda that might be, or some kind of information booklet between the home and school, to let families and teachers connect about what may be working or not working. For example, might be anticipating an MRI coming up, and with that there could be a lot of anxiety, and just giving the teacher a heads up that might be a reason why a child might be a little bit distracted or a little bit withdrawn. Just again, trying to identify and plan for circumstances where there may be a change in behavior, which then could affect learning. And of course, there'd be the physical issues in terms of safety risks, and all of these things again can be in the individual learning plan. What, for a child who may have balance or coordination issues, perhaps when there's a crowded hallway, you can plan and have an agreement that the child is released from class 5 minutes early so they can make it to their next class, or that they, have certain area within within the school that they can actually plan a route out beforehand, or ensuring that lockers are close by, or that they don't have to carry all their books from class to class, things like that. But certainly all these things can be incorporated into a plan. From an organizational perspective, so there's the learning, but then there's the learning how to learn. And it can be very helpful when, certainly if there's working memory issues or difficulties with attention, simple, concrete directions can be very helpful. And sometimes having it not just said, because it might be hard for them to hold on to that information, but also having it written as well. Step 1, step 2, step 3. Having your child repeat that information, your student repeat that back to ensure comprehension. Again, it's that idea of the multisensory piece. Breaking big tasks like projects into small, manageable steps. First, we do this. After you've gone and gotten this information, come back to me, and then check in, make sure the child's on the right track. Then go out, what's the next step? And then actually have them, depending on what level of schooling they're at, predict what might be the step after that, instead of sending them out and having them do an entire project, or which then ends up sometimes being that the parent ends up having to do all that. Teaching study skills. I don't know about everyone listening, but the use of highlighters has, I think, been the bane of many teachers' experiences, in that you'll see crinkled, rippled pages that are completely covered in highlighter. Learning how to highlight, how to underline, how to identify key concepts is a very essential skill for learning how to learn. And those are certainly things within the Ontario school system. Within some of the withdrawal classrooms, there's aspects that are focused on study skill development, but also within high school, there's actually a course for those, particularly on individual education plans, for what's called a General Learning Strategies class, GLS, where it's explicit, it's time where they can get some help with some of their course, but also where they can actually work to learn some valuable study skills for how to kind of identify, read for meaning, as well as have some other supports. Scheduling, planning, and reviewing how to do that is also a key part of learning how to learn, and certainly one that there's a lot more focus that's being placed on. And again, from a purely from a purely logistical perspective, having just a second set of textbooks between home and having a set at school, if possible, if resources allow, can be very helpful, particularly for brain tumor survivors, in that backpacks are heavy enough as it is. Having to hoof things back and forth can be a real challenge. So those are some of the organizational strategies. But let's get to our reality. There are smartphones, there are tablets, everyone has something like that to some degree. It might be a very simple phone for emergency purposes, to the point where you may have a tablet that comes everywhere with you. Certainly for individuals who have sensory challenges or perceptual deficits, such as hearing and vision deficits, these tools have been invaluable. Some of the latest generation of the Macintosh and Samsung products have actually opened up whole worlds for individuals. Up here, I've just made as a note, a lot of people don't realize that if you have a Generation 4 iPhone or iPod moving forward, or typically iPhone, I think, they have any of those iOS devices have what they call speech selection. And I just, up here on the screen, you'll see, you just have to go to your settings, select general, accessibility. Literally, it is making this information accessible. And then you can actually have it so that it highlights words and or actually reads the words. It becomes a text-to-voice reader. And that can be incredibly helpful for children with reading or literacy challenges. There's online, certainly open source software. These are just a couple of examples of text-to-voice. A lot of schools, after going through the identification process, if literacy, if there are vision problems, and or if there's significant literacy issues where a child is really having challenges with learning to read and reading efficiently, they may well have access to programs such as Kurzweil, which is kind of the Ferrari of those that type of software, where really textbooks can be scanned in, and the child then is able to hear it, hear the text. They can choose the voice. They can use it to highlight. They can create their own study notes. There's a lot of valuable things out there, but I don't want people to think they have to rely on the Ferrari when there's some fabulous sources that are available that are open source free software. I do encourage parents, if this is an area of concern for their children at school, to consider talking to the special education teacher and potentially the IT, the information services around accessibility and how you can access these kinds of things. Similarly, on the other side, using word processing software. It can be very, very helpful for children who have slower written output. Learning how to type properly. I actually will afterwards send through a couple of other links that perhaps we can include or put on the Brain Tumor Foundation website of some really nice, engaging, not many of them are engaging, but some nice keyboarding software. For example, Dance Mat Typing, which is through the BBC, the British Broadcasting Corporation website, is a really great keyboarding program that I know many children on the younger side, so more school age, kind of grades 1 to 5, 4 or 5, find quite useful. And learning how to navigate around a QWERTY keyboard can be very valuable for children as they move forward, because then it becomes something that they do and doesn't have to be as onerous as something else that they have to learn. Certainly children who've had a great deal of cranial spinal radiation, that can be a little bit more challenging, but it's certainly worthwhile. And of course, using other word processing software such as something like WordQ can be very helpful in terms of for spelling and for word prediction. I want to just introduce one interesting type of assistive technology, and I won't go over in detail. You can hopefully go back and look at it, but it's a smart pen. This particular type is called Live Scribe. This pen is approximately close to $200. But it's used by many people, and really what it does is you're actually writing and it records what you're writing and hearing. So in fact, it's a live recording of what you're engaged in. You can You have to use a particular type of paper. It's like a dot paper. It kind of acts as a GPS or a map, so the pen can track everything that's being written. But then you can afterwards go back and put your pen down at a certain point on that page, and then it will then replay what was being heard at the time, and or this stuff can be transcribed. Literally, some are wirelessly, can be transcribed to Evernote, different types of software. And also you can listen to it on an iPod. So this is a really innovative way of using assistive technology to help learners hold on to information, review information, and not necessarily miss that information. So this can be useful, particularly I think within the late high school and into the secondary school time period. It's called Live Scribe. Some testing strategies. Just realize that I have more slides than I do time. But what I do want to do is just highlight that assessment of knowledge is an important part of an IEP, of a learning plan. And it can be very important for educators to modify the content or how they're graded or scored, ensuring that you can pre-teach some vocabulary, and allowing a child to retake a test so they have the experience of going through it, but now then going and understanding what they did wrong and then going back. Now, I talked a little bit before about extending time limits. That can be very helpful and can also minimize stress for a lot of individuals when they're writing so they don't feel as pressured about the time. And I think for a lot of students that I work with, having different forms of assessment of their knowledge is really important. So instead of full, let's say, essay answers in the high school level or even in post-secondary, having potentially the opportunity to write in point form, or to, instead of having everything weighted on one test, perhaps distribute the weighting across the different assignments, using recognition instead of retrieval, which is that rote memory, so maybe multiple choice. Open book exams can be very appropriate for some kids, and that really, again, depends on the assessment of memory and memory function and recall. And using note cards, which the student has determined that these are the points that are important to know, as opposed to writing everything down. So it's not a cheat sheet. I like to think of it as a fact sheet. So then it's about planning for the future. And the individual education plan can, and hopefully often it does include transition goals, and that can help students and families plan for life beyond high school. But moving from high school to university or college or a vocational training environment means that the expectation is different about how an individual advocates for themselves. So what is required of a student may well change. There's lots of transitions that are happening at this time in life, and certainly the April 4th webinar will be talking a lot about transition and some of the emotional and psychosocial kind of coping, but all the transitions that happen along the entire journey. But what I just want to highlight is that at the same time that we're going to school, you may well also, your child may well be moving from a pediatric program to an adult program. And where that child is, where your child is developmentally on that trajectory of going from child to teen to young adult, can be all over the place. So while these arrows are somewhat lined up here, in reality, your child can be anywhere at different points on that continuum. And that's an important thing to remember as you're planning as a family moving ahead. So there are some fabulous transition programs. I'm not going to be Ontario-centric, but I do want to just highlight one of the programs that exists. SAUTI is a short form for the Successful Academic and Vocational Transition Initiative. That was supposed to be a temporary name. It stuck. We call it SAUTI. It was developed in 2002 as a collaborative effort between the Hospital for Sick Children, the Pediatric Oncology Group of Ontario, George Brown College, and there's ongoing funding. And it's something that I think is happening in different ways across the country, but I just want to highlight kind of what the program does. And I think you can take the core of this and the skeleton of this and apply this to working and planning for your child, your teen, and having your teen plan moving forward. It's really about crossing the silos between the health sector, the education sector, and what that means for vocation and employment, and potentially social assistance. It's a counseling process. The way I talk about it with a lot of teens, I say, think of it as your own personalized guidance counselor who actually gets having had a brain tumor. Because not all guidance counselors understand that because they may not have gone through that experience. While our counselors haven't necessarily gone through that experience, they have full appreciation of the breadth of opportunities and challenges that survivors may face. What they try and do together with the healthcare team is really help the teen identify what are some career options and how does that fit, like what your dream is, how does that fit with your classes, your prerequisites, do you have the prerequisites, and how does that fit with your strengths and weaknesses as we've kind of determined with some assessment. Helps together with the team develop a personal educational or an employment plan, and it's important to know that SAUTI works with individuals from around 16 years of age all the way through and follows them into adulthood. Helps them prepare admission to college or university or for jobs. I know of a few counselors that have actually done some mock interviews and actually helped individuals with retraining who are in their mid to late 30s. Helps link them with services. So it's not about reinventing the wheel, but it's also about linking with the services that are so effective that already exist. And then talk about what are some of the strategies that you need to have to be successful in post-secondary as well as in a work environment. And again, as always, coming back to focusing on the individual strengths and skills. I know that in BC there's a fabulous program, and I encourage those who are able, even if you're not in British Columbia, to check out this website, the teentransitionplanning.ca. It's a coordinated, again, it's about leveraging all of the things that already are out there and taking advantage of some of the systems that already exist. They actually have a PDF on the website, which is a kind of a planning binder that families can go through to start thinking about identifying some of the, not just issues for academics, but self-care, healthcare management as well for individuals with special needs. So this isn't necessarily specific to individuals who are brain tumor survivors, but I think it could be helpful for pretty much any teen and family moving forward. Really, there are numerous different sites that are connected within British Columbia, if that's where you're from, and I do encourage everyone, if they can, to take a look at it, and also at their the kind of an abbreviated PDF there. So school and life, there's some practical steps. Once you've identified what it is that you might want to do, or now I'm speaking to the teen, it's really important to check out the campus. Go there before it starts once you've gotten accepted. They may call it a disability center, they may call it a student center, they may call it an access center, but check out what kinds of support is available. And in many cases, there may be a need for documentation to verify eligibility. Might need to have letters signed by a physician or healthcare team, or a neuropsychological report that's current. So often, when we do assessments, initially we'll do assessments, as I said at the beginning, at maybe baseline. That's predicated and initiated by the diagnosis. But by the time we move on to aftercare, by the time we move beyond the disease and the treatment, the timing then becomes dictated by the environment. What are the demands? So it could be the transition to high school, so we will try and do something in end of grade 7, early grade 8, so that information can help with the decision of what stream to be doing in high school. Again, anticipating moving into post-secondary in whatever form, doing an updated neuropsychological report is really, assessment is important, can be important as resources allow, because it then shows progress over time, but it also demonstrates what are the current needs and what are the current abilities as well. Super important to learn about financial aid scholarships that are available to the brain tumor survivor. Certainly Brain Tumor Foundation of Canada is one of them, and now has an education award for young brain tumor survivors, and I understand from Tanya that in fact it's not just for admission, it's for the actual full course of the education. So I do encourage people to check that out, and the link will be at the end. Lots of different organizations do indeed have education awards, and I do encourage families to check with social workers doing their healthcare teams. That is one valuable resource, as well as some of the other resources in your community, which in Ontario we have things like Brainchild. There are many different resources throughout throughout the country. And once you identify the resources in a particular education setting, take advantage of them. There are libraries, computer centers, study school workshops, lots of things, early orientation so you can get to know the campus or to get to know how to get to and from if you're still living at home. And I think at the end of the day, much like with high school, it's about selecting courses to ensure a manageable workload. I didn't talk much about that in high school, but I think it is important to consider an extra year, for example. Perhaps not a full course load, so instead setting the student up for success. So instead of perhaps four courses a semester, perhaps 3 courses a semester, and then having an extra year or taking a course in the summer. That's often been something, certainly I have a chunk of students that I've worked with where that's been a really valuable step, and especially in Ontario as they move down to the 4-year high school degree. The fact is, many people come back, up to 40 to 45% of students, regardless of whether you've had a brain tumor or not, come back for what they call the victory lap. So there's no reason not to set yourself up and take those extra courses or to take the courses in the way that best suits an individual. Same thing applies to college or university. Make sure that it's a manageable workload. And then there's life. Make sure that you're considering that a living situation that really fits with the needs or any physical challenges that someone might have. Think about the distance to campus or to work. Lots of different campuses, if your child is thinking about living on campus, will give preference or priority to students with medical issues. For example, single dorms or dorms that have accessibility. Making sure, of course, like I said at the beginning, a lot of people, once they go to university or they leave kind of the pediatric world, there are some students who just don't want anything to do with their medical history. But the fact is that this is part of becoming an adult, is taking ownership not only of your academics, but taking ownership and understanding your health needs. So most physicians, some places will, in fact, you'll stay with the same hospital all the way through into adulthood. I know certainly the Hospital for Sick Children, our patients, they graduate at the age of 18 and they move to adult aftercare. So at that time they receive we call it a passport, or it's a letter that provides a treatment summary and talks about late effects and a monitoring or a care plan. And I just really can't encourage families to just think about how ongoing attendance at aftercare or follow-up appointments beyond treatment is so incredibly important. And obviously, there's the medical late effects that I alluded to earlier, but it's important because issues of fertility, again, I'm talked about insurance, checking about cardiac, heart health, lung health, ongoing development is going to be really important. And unlike a lot of chronic conditions, this is not something where you may be taking medicine, but you may not. And so you may not be feeling anything, but it's really important to just have that healthy lifestyle approach. So I do encourage our teens and young adults to be connected with some kind of informed health care moving beyond. But of course, moving beyond is also about having fun. So you want to get involved in lots of things, but you want to be careful about how much you get involved in. So I'm going to speed through these last few slides because I do appreciate that we're getting close to the end and if there's any questions. But other transition considerations are about how students manage their own time. There's not as much structure. How do they act as their own advocates? And I have to say, parents, really how you advocate for them is a model for how they will advocate for themselves. But similarly, there has to be an expectation that they learn to advocate for themselves. So it is a shared responsibility. May need to initiate contact with instructors, initiate contact with that access center so that they can get supports. Post-secondary education in whatever form can be at a faster pace. There's less immediate feedback. You might be in a very large group or a large lecture hall. You have less contact time. So that's where those skills of independence and organization are so vital. And that's why we want to start working on those really during those early high school years. And what that means is thinking about what happens beyond. If they're going to workplace, I have to say one of my favorite things about high school in the last 10 to 12 years has been the introduction and access to such a huge variety of cooperative placements. Huge advantages, very minimal drawbacks. There can be things that people dream of doing. It could be working with children, and then they actually do a co-op and they're like, okay, maybe not children that young, or maybe not children that old, or I want to work in an office. Maybe not that kind of office. But what's great is that they get the experience. They get to learn about employer and employee expectations and responsibilities. And as well, they get to decide if this is actually what they thought it was. It's kind of like a trial experience. And worst case scenario, they get their credits that go towards their high school degree. Best case scenario, it affirms what they want to do. They may make a great contact. They might get a summer job. They might get letters of reference. So really, I think that it's a win-win on all fronts. So I alluded earlier to the healthcare transition. Important to be thinking about and teaching about their own knowledge about their own care, how they manage their own care, their understanding that really at a teenage, they could be calling in their own medical scripts. If they need a renewal of their thyroxine or some other kind of medication, they can call that in. There are things, they could be making their own appointments. And I do encourage individuals to be thinking about that before the actual transition day, because the more practice, the better you are and the more successful you are. What I just highlight here is that really there's so many transitions that happen. You go from being family-focused to young adult-focused when you move into the adult world. You go from parental decision-making, or hopefully family-centered decision-making, to more individual autonomy in the adult healthcare world, and really more child-centric, flexible treatment to what tends to be much more of a standard treatment approach. It's not worse, it's just different, and anticipating that, I think, is key. So I guess I want to leave you with the idea that over the course of the back-to-school experience, there's a lot of transitions. There are the developmental transitions, the social transitions, but they all are focusing towards leading to autonomy, to being independent, and that means not just beyond the high school years into post-secondary and the workplace, but also in the healthcare system, because all of those things are going to be their new reality, and it all feeds back on each other. Because at the end of the day, the journey that began at diagnosis is going to be a lifelong journey, and that transition throughout the school experience will have many essential milestones throughout. And I want to leave you with this picture, which reminds me, as a neuropsychologist, that we can't measure everything. So the young man who I worked with early in my career, he drew this picture. He had horrible headaches, could only work for 45, 60 minutes at a time. His family was told that he wouldn't be able to work independently. This is what he could do, and we couldn't measure that. He had very poor memory. On a neuropsychological assessment, it didn't look like the wonder that what you see before you. And for me, this is a very important reminder of it's not about the numbers, it's about the person and the family and the journey beyond. And I want to say that he is now gainfully employed, and he is carving. He's doing wood carving on custom doing custom mantles and doing very well. So I want to thank everyone for your time and attention, appreciating that I'm exactly at 1 o'clock. So if there's any questions, please let me know.
Okay, so we don't have any questions quite yet, but I just wanted to go over a couple of last things. If there are any questions, feel free to type them in now or send them to us afterwards. But Sharon, if you want to pop up that last slide for us.
Sorry.
No worries. Thanks. So just a quick reminder, we have another webinar. This one was originally scheduled for earlier in March, but it's been rescheduled and is going to be happening on Thursday, April 4th at 3 p.m. Eastern Time. And that will be presented by David Brownstone, also from Sick Kids. And the title of that session will be Transitions, Managing Change Along the Journey of a Pediatric Brain Tumor. So if the issue of transitions is something that you're interested in learning more about, that'll be a fantastic session presented on Thursday, April 4th. And that also will be recorded and available on our website afterwards if you're not able to attend in person. We have our Information Day sessions that are live conferences that are coming up starting in April. We've got Moncton coming up Saturday, April 13th, Edmonton on April 27th, Ottawa on May 25th, Halifax June 8th, and Vancouver June 22nd. So you can visit infodays.ca to find out more information or to register for any of those conferences. And the Education Awards that Sharon alluded to earlier in her presentation, those are they are scholarship awards for young adult survivors of a pediatric brain tumor, and information about those can be found at braintumor.ca/edawards if you wanted to find some more information about that. So once again, thank you so much, Sharon, for your time today. Thank you, everybody, for listening and for being part of this. And it was lovely to learn so much about this back-to-school transition, this back-to-school time, and I hope that you all learned as much as I did, and that you come away with some new knowledge and new skills for empowerment and advocacy in your lives as well. So we are going to be sending out a survey after the fact about this session, so we'd love to have your feedback on that. And actually, Sharon, we do have a question that came up from one of our participants, and she was wondering, is there are there information sessions, or do you know of any sessions available for teenagers to learn how to be self-advocates?
Oh wow, that's a really great point. You know what? A lot of hospitals now have a lot more focus on promoting transition. I know certainly within Ontario, we do have an actual transition program at the Hospital for Sick Children. It's called Good to Go. And I actually would encourage people, if they get a chance, to go to the Sick Kids website. And I believe there are some links there around some transition programs that are actual for teens to attend. They have them 3 or 4 times a year, and so that is certainly something that it's open to all patients of the entire hospital, but the issues certainly are not unique to brain tumor survivors. I would also just check in with your own healthcare team at your particular hospital and ask about teen transition and if there is anything actively going on. Certainly there's a lot more focus on this, because we're appreciating that while we've been preparing, we do a great job preparing children for the fact they're going to finish high school. We don't do much of a job preparing them that they're going to leave their hospital or the pediatric program. So I think it's a really good question, and I know that there's a lot more focus on that in a lot of the healthcare centers across the country, but I can speak only to the Sick Kids one at this point.
Okay, thank you very much. I also wanted to do a shout out for the Vancouver Information Day. Now I know that being such a big country, it's not always possible for all of us to be everywhere at once, but that is one of the topics that we're going to be addressing at that Information Day. So if you are in the Vancouver area and you're interested in that topic, then that is something that's going to be a part of that day. And those sessions are usually recorded and also available on our website after the fact as well. And so if you can't participate, then you can look out for the information after the fact as it gets posted on braintumor.ca. So once again, thank you so much, everybody, for taking part in today's session, and I wish you all a wonderful rest of your day this Saturday. Have a great day.